and welcome to the third edition of Inside OSA, an information-packed resource for the millions of people suffering from OSA. I'm Sherry Smith, along with John Matthews. Inside OSA provides valuable insights on how to manage sleep apnea and get the most from therapy. In this edition, a sleep expert helps us understand how regular nightly use of therapy can minimize the disorder's health risks. A group of patients recalled their first days and weeks on therapy and the subsequent impact it had on their lives. And John Matthews explores the treatment process. John, what do patients need to know about managing their OSA?
Sherry, patients should become as well informed as possible. This doesn't mean that people have to become medical experts, but they should understand the risks of untreated sleep apnea and the treatment options. Awareness and strategies for addressing side effects is also very important. Studies show that the more people understand their sleep disorder and treatment, the better they are able to accept and use their therapy. Sleep apnea causes a person to stop breathing repeatedly during sleep. It's a vicious cycle. The nighttime pauses in breathing prevent restorative sleep and place a tremendous strain on the heart and blood vessels. What happens in people with OSA is that the tongue and soft tissues in the airway relax during sleep. When the tongue and tissue totally obstruct the airway, it prevents fresh air from reaching the lungs, despite efforts to breathe. The oxygen content in the blood goes down. The brain recognizes that there's a problem, and it briefly arouses the body from sleep just enough to open the airway. It also stimulates the heart to beat faster and the blood vessels to constrict to send blood and oxygen to the vital organs. Regular breathing is restored, but the cycle repeats itself, sometimes up to 100 times a night. Sleep apnea is usually treated with positive airway pressure, more commonly known by the acronym PAP or PAP. PAP devices provide a gentle stream of air through a nasal mask to keep the airway open during sleep. There are various types of PAP therapies which sleep professionals prescribe for specific reasons. Continuous positive airway pressure, or CPAP, provides one constant level of pressure to splint the airway open and prevent the obstruction and apnea from occurring. C-Flex is a new technology that's been added to CPAP devices to provide more comfortable therapy. Flex technology lowers the pressure at the beginning of each exhalation for added comfort. In some cases, the sleep specialist recommends alternative PAP therapies. Automatic positive airway pressure monitors the upper airway and adjusts the pressure throughout the night on a breath-to-breath basis. With bilevel therapy, 2 levels of pressure are used to splint the airway open. A higher pressure is delivered during inhalation and a lower pressure is delivered during exhalation. Both automatic positive airway pressure and bilevel therapy are available with Flex technology. Less common treatments for sleep apnea include surgery and oral appliances, which may be effective in certain individuals. Insurers may require a trial of positive airway pressure before they will pay for these alternative treatments. To learn more about how patients adapt to PAP therapy, I spoke with Dr. Kingman Stroll, Professor of Medicine at Case Western Reserve University. Now, Dr. Stroll, let's say a person has sleep apnea. What should they expect from therapy?
A patient should expect to use PAP therapy as a treatment, not a cure. And PAP therapy consists of several mechanical elements that they should be aware of. The first is a machine that provides flow. The second is tubing that goes to the mask, and the mask that goes on the patient that gives the pressure and supplies it to the airway to reduce the obstructive apneas.
What benefits can a new PAP user expect to feel over time?
The most immediate effect is that of increasing vigilance during the day, reducing their sleepiness, and being able to be more effective in their work, more effective at home, being able to communicate their wishes and desires to other people.
What are the heart problems associated with sleep apnea?
Well, the apneas that produce the increased blood pressure and increased cardiovascular stress, when they're eliminated by regular use of PAP therapy, reduce your daytime blood pressure and make it easier for your heart to work, so that if you have congestive heart failure, the management of that heart failure is easier. Or, for instance, if you have coronary artery disease, have nocturnal angina, it can stop those events from happening because you no longer have the apneas during sleep.
What are the elements of effective PAP therapy?
Well, effective therapy, let's first define that. The first thing is effective therapy is based upon the patient understanding and accepting this as therapy. The next feature that we have to think about is how can they use it every night? And that's a comfort issue. A person has to be comfortable putting it on, comfortable with the mask, comfortable with it not having leaks, comfortable with the whole process. And that includes who they sleep with and other parts of their family. The last is that usual use, regular use, nightly use of CPAP has the best results in reducing blood pressure, reducing daytime sleepiness, and increasing vigilance, increasing their activities during the day. You should expect to be able to take it on vacations. You should be able to take it on weekend visits. You should be able to even take it overseas. Use it and make it as part of your life because it's the best sleep you can get.
Other than using PAP therapy all night, every night, are there any other lifestyle changes you recommend for new patients?
Well, one of the most common things I see is that people think that treatment of sleep apnea with PAP therapy will actually eliminate all their sleepiness. So these people go back to sleeping only 3 to 4 hours a night. So the important thing is to pay attention to making sleep an important time of your life. Enough sleep, effective sleep for 6 to 8 hours a night is important, part of PAP therapy. Fitness is important in terms of improving your overall fitness and reducing weight, and attention to your cardiovascular health in general, because sleep apnea is not the only problem that can produce hypertension and cardiac diseases.
How does the diagnosis and treatment of OSA affect the rest of a patient's medical care?
Well, there's been some surprising new findings that treatment of sleep apnea improves vigilance, reduces pain and other conditions such as arthritis that occurs the next day, perhaps because people are more alert and less fatigued to begin with. And one of the recent findings from the diabetes literature is that treatment of sleep apnea improves diabetic control, or may even reduce the risk of being pre-diabetic going to diabetes.
Well, Dr. Stroll, thank you very much for your insights.
You're welcome, John.
As an aid for patients who are embarking on the treatment process, we've compiled a summary of helpful tips on how to get the most from PAP therapy. Your healthcare team will check on your progress many times, especially early on. Be sure you know approximately when to expect your follow-up contacts from your lab or home care provider, and be prepared to provide accurate information on your progress. These calls are a good time to discuss any of your questions or concerns. You will also schedule follow-up appointments with your sleep specialist and primary care physician. To get the most out of your office visits, take paper and pen with you and take notes. Be sure that you ask questions about anything that you don't understand. If you worry that you will not be able to capture all of the information, consider having a friend or family member go with you. While you're at home, make note of your sleep habits, PAP therapy use, and any residual symptom you have. For example, are you still sleepy when you wake up? How about later in the day? Do you have increased energy? Is there a particular time or circumstance when you have trouble tolerating your PAP therapy? Your evaluation will help the sleep specialist and home care provider guide you toward improved use. They may also ask you to complete questionnaires. In some cases, you may be asked to provide access to information that specific PAP devices automatically collect on therapy use. This